Good afternoon. This is Leslie Meehan with the Tennessee Department of Health. We are very excited to have over 450 of you join us today as we continue our health equity series. For those who are joining for the first time, we started this series last year, right at the beginning of the COVID pandemic. We believed as public health that it was really important for us to not lose the forest for the trees, if you will, and to make sure that while we were focusing on COVID, we were not ignoring racial injustice and the root causes of health disparity and the factors that determine social determinants of health in our nation. Last year, we addressed some of the basic tenets that we all need to live life to our fullest potential and to have a high quality of life. We addressed jobs, education, housing, transportation, parks and recreation, and food systems. We had several thousand of you who joined us for those honest and open dialogues, where we not only talked about how COVID-19 and national conversations around racial inequity have changed the landscape for many professions, but we also talked about what is the role for public health in partnering with other sectors to make sure that we are again addressing the root causes of chronic disease and inequity. Based on the overwhelming feedback we received from that Coffee and Conversation series, we developed 8 different webinars this year and have folded them under the umbrella of our Health Equity series. You essentially wanted to know a little bit more. You wanted a deeper dive. And housing by far last year was our most popular session. We had everyone from physicians who have patients that talk to them about challenges with housing. We have ministers who have folks in their congregations who also bring up challenges in housing. This is not unique to Tennessee or to the United States. This is a global phenomenon. And in our state, we have a shortage of attainable housing in both our rural and our urban areas. Many of us are not able to afford housing for ourselves and for our families. The housing is not safe. And we just don't have enough housing stock for all of the Tennesseans in our state. Today, we bring you 3 experts who are going to share their perspectives about what the housing arena looks like in their positions. We're going to start with Dwayne Spencer, and he will introduce himself, and then John Corns and Zach Oswald. Each of them will explain a little bit about who they are, their backgrounds, what organization they work with, but more importantly, what is the landscape from their perspective, and how has the last year and a half changed for the better or maybe for the worse, the work that they're doing and the goals that they are trying to achieve. So with that, I'm going to turn it directly over to Dwayne to kick us off. And each speaker will have about 8 to 10 minutes for remarks, and then we will enter into some dialogue. Please remember that you can enter your Q&A into the chat box, and we will get to your questions towards the end. Thank you so much. And Dwayne, turning it over to you.
All right, Leslie, thank you so much. I'm happy to be here with you. So again, Dwayne Spencer, I'm the president and CEO of Habitat for Humanity of Greater Memphis. This is my 20th year with the affiliate. And if you don't know how we work, we're a federated organization. So I am an affiliate of the larger international organization that's been improving people's lives via decent, affordable housing, home ownership for 40 plus years. And we work in more than 70 countries around the world. You probably didn't know that, right? Here in Memphis, we've been an agency since 1983. And so we're celebrating 40 years in 2023. And in that time, we have built 570 affordable homes or created 570 affordable mortgages. And then in 2015, we shifted a little bit, well, a lot as of late. So we shifted to a new program called Aging in Place. And that has been keeping us extremely busy. And that entails doing critical home repairs and modifications to help older adults remain in the homes they love. And so far, we've done about 1,000 of those in our service area. So in regard to today's panel and subject matter, I was asked to talk a little bit about racial inequity and disparities, and I wanted to go back and do a little bit of a historical perspective first. So first of all, our organization, Habitat for Humanity, was founded and built around the principle of racial inclusivity, and that remains one of our core guiding principles to this day. And to that end, our organization works to keep all of the affiliates, keep all of us informed, in particular on the history and the ramifications of racial inequities in housing policy. So a lot of what I'm going to share comes from a wonderful policy paper that was created by our talented team. The paper is called The Role of Housing Policy in Causing Our Nation's Racial Disparities and the Role it must play in solving them. And so, as we all know, racial inequity has been in our country from the very beginning. And as the government, the federal government, started to pay attention and try to address housing issues in the 1930s, they created the Federal Housing Administration. And they were going to help people coming back from the wars be able to achieve home ownership. But a lot of the FHA's policies just didn't really apply to Black households. This is where we started getting redlining, those color-coded maps that define communities of color as unsafe for lending. And that really shut off Black families from being able to access opportunities to affordable home ownership. And then they have the GI Bill to assist veterans who are returning home, and all of them, Black and white, coming home from World War II, had dreams of buying a house and settling down with their families. They were going to get a low interest loan with little to no down payment. However, those federally backed guaranteed loans were being originated by private lenders. And these lenders have the flexibility and the ability to deny loans to Black families. And that's what they chose to do, unfortunately. And so here's a statistic for you. Between 1934 and 1962, households of color received only 2% of all government-backed mortgages. So just think about that. So if homeownership is one of the driving forces to financial security today and then, people of color lost decades and are still struggling to catch up. And at the same time, we had our wonderful highway system starting in the 1950s and transforming the way we travel across the country. That was wonderful. But many of those highways were cut right through Black communities and further displaced Black households. Then in 1968, we got something called the Fair Housing Act. And it was going to radically restrict and prohibit discrimination, and it did have some improvements, but right after that came exclusionary zoning, and that was intended to divide people by wealth and income. And so it really had a lot of the same basic impact, which was shutting Blacks out. And since so many redline communities continue to be passed over for those loans, in 1977, we got the Community Reinvestment Act, and it was going to hold banks more accountable for meeting the credit and banking needs of their entire community. That included Black folks. But for many of those same institutions ended up coming predatory mortgages. That just happened in like the last 20 years. I think we all remember you'd come home and you'd have all this mail. Everybody was offering to refinance your mortgage, or you could buy a house. And many of them were predatory. And I will tell you our own personal story, one that's very painful for my affiliate, is that in the early days, we didn't have a lot of safeguards in place for our homeowners. And many of our families fell victim to predatory lending. And they thought they were going to be able to pull equity out of their homes and keep their zero interest mortgage. Again, that's what we're famous for, a zero interest mortgage. But what they did is, yes, they pulled money out, but they were refinanced back into 7, 8, or 9% interest mortgages, which eventually they could not afford. What happens then? Foreclosure. And so we had several homeowners here in Shelby County, Habitat families, to lose their houses. It was painful for me. It was painful for those families. And so ultimately, we realized that we had to do something drastic and very quick. So Tennessee followed North Carolina in activating some legislation that said that low-income families with zero interest mortgages could not refi into an interest-bearing mortgage. And so we didn't get to save everyone, and we learned the hard way, but those restrictions are in place right now, and they are protecting our families still today. So I mentioned all of that history because these race-based exclusions from federal mortgage programs and bank loans, Black families having to live and raise their children in communities with vastly unequal schools, meaning unequal educational opportunities, then with Black parents having less ability to finance their children's college tuition from their home equity, that contributed to higher student debt for Black students. And then as of late, these same families, many of them being victims of more insidious actions via predatory mortgages. I mean, it all has sort of created a huge intergenerational inequity that explains a lot of the disparities that we see today in wealth, income, and then even educational outcomes for Black Americans. And so before I close, I want to share just a couple of statistics that also come from this policy paper. One of the clearest legacies of these past racial discrimination and continuing housing inequities is today's stark gap in homeownership rates between Black and white families or households. Blacks are at about 44% homeownership. Whites are at almost 74%. So 44% versus 74. That's a 30% gap. So that's what we're facing, is that white families just had a head start and Blacks are still catching up. And so this huge racial gap in homeownership is a major reason for the tremendous wealth gap between Black and white households. So since home equity is the primary wealth building vehicle for middle-class Americans, we've got a lot of catching up to do. And the last statistic I'll leave with you is from 2016. The median net wealth of white families was 10 times greater than that of Black families. 10 times greater. White families in 2016 were at about $171,000 versus $17,600 for a Black family. And so we've got a lot of work to do. And many of the folks that we help, while our program here at Habitat Memphis and all across the country is certainly open to any one who falls between 80% below AMI. In Memphis, the majority of our families are African American, and we feel like we are doing the heavy lifting and the hard work of creating home ownership for them and bringing them out of poverty and into sort of the wealth building world of home ownership. And I'll leave it at that. I'll turn it back over to Leslie. Thank you.
Thank you so much, Janine. That was incredibly important for us to hear that history. It's hard to hear that history. And one thing that I will share is that I'm an urban planner for those who I haven't had the opportunity to meet. And it's been really interesting to be an urban planner working for a public health department. And in the world of urban planning and in the world of transportation, the last year and a half have been very formative for us, because I can't tell you how many colleagues I've talked to across the country who were unaware of redlining, who are unaware of a lot of the history. I think some of the interstate dissection of communities was known, particularly in the South, but in terms of the accompanying land use, where we were really talking about where people could live and where people were prohibited to live, that was not a part of a lot of urban planners' education. And I worked for over a dozen years in an urban planning department and can tell you that never came up. And I think that's very telling of how those professions have tried to sweep these issues under the rug. And it's very embarrassing, to be honest with you. It's hard to admit that, but that's exactly why we're having these conversations today, because this information needs to be known and understood, and it's not particular to one sector or other. We're all in it together. So thank you for that, because that was the perfect way to tee up this conversation. So John, I will turn it over to you now. We are excited to get to know you a little better. Sorry about that. John, you may be on mute. There we go.
Okay, yeah, great. Thank you, Leslie. Thank you all for having me. I'm glad to be a part of this conversation. I'm a native Memphian as well. Currently, I'm a licensed real estate broker with licenses in the state of Tennessee and Mississippi with a company called Braden. We are a commercial real estate primary focused firm. Probably the largest minority-owned real estate firm in the state of Tennessee. My background, I got my real estate license in 2008, and at the same time, I was working in corporate America doing accounting. I got my degree from Lemoyne College, so I was doing accounting work with various organizations, and I did real estate part-time because I figured the people whom, at that time, I was just residential focused, the people whom I showed houses to, they can view houses after work and on lunch, just like I would. But fast forward, I wanted to dive more into commercial real estate, went to a different number of companies. My broker, Curtis Braden here, he's a native Memphian as well. And it was important to him to start his own company to really pour back into the community as well. So joined him at Braden, and we've been moving forward with commercial real estate ever since. Now, I'm going to wear a few different hats during this call. I really appreciate the work that Dwayne is doing at Habitat for Humanity. I'm on the board of Fraser CDC as well, Fraser Community Development Corporation, where we have some similar goals such as Habitat for Humanity as well, where we want to promote home ownership in Fraser, healthy home ownership in Fraser, that's a caveat. Also spur on economic equality and community development as well. So, and I know Dwayne talked about foreclosures. Fraser got hit hard with foreclosures. If I'm not mistaken, they led the state of Tennessee in foreclosures at one point of time. So that being said, we had a really big, deep hole to dig from up under from the foreclosure perspective. But during that time, you have all of these investors, these cash investors coming in and buying houses, pennies on the dollars, and then renting them at high rates. So what that does also, it takes away from economic equality, because if you have to pay $1,000 in rent where your next door neighbor who owns their home is only paying $600 in mortgage, you have less disposable income. So that could go to that directly affects health inequity, because you may have less to spend on healthcare, less to spend on healthy food options, less to spend on quality time and healthy options, gym memberships for yourself or for your kids. So, and again, Dwayne also mentioned how it affects schooling as well. The lower the property values, the lower the funding that goes to schools. So therefore, the lower potentially resources that you have for educational, components as well. But so that's another hat that I will be wearing during this call. One of board president of Fraser CDC, where we talk about those same policies of redlining, how the FHA and governmental policies affected us then and continue to affect us now. One of the things that I like to illustrate when I'm talking about this is you have a dollar that you purchased in, let's say, 1960. And this was before people like me could buy a house through an FHA loan. Well, my next door neighbor or someone in another community, they have that same dollar and now they can sell it for $20 because of the appreciation and wealth built through housing and homes. So this literally, is basically an example of how wealth was created through real estate and policy through America. And now we're just, really behind from an African-American standpoint because of those policies. But so that's a little bit about my background. And I'll also be talking from an investor standpoint as well. I do property investing. So I'm looking at everything globally from a 360-degree level, from policy all the way down to the tenant that needs help or the tenant that needs affordable housing as well.
Thank you so much, John, for being with us. And thanks also for that visual. It's a really powerful illustration of how wealth is accumulated in our country for some, but not for others. Really interesting book called Know Your Price that gets into some of the same history that you were just speaking about the accumulation of wealth through a home and how over particularly several generations that has resulted in huge wealth income gaps, as both you and Dwayne have mentioned. So now we're going to turn to Zach, who has a little bit different role, but just as an important role in the housing arena. Zach works with the Legal Aid Society, and I think one of the most telling statistics that I heard in the last year and a half was right in the height of the pandemic, when there were still a lot of closures. We had restaurants shut down, hotels shut down, all different kinds of jobs were just erased and put on pause. And I heard at one point that we had about 25% of Tennesseans who were either not able to make a rent or a mortgage payment, or who had already missed a rent or a mortgage payment. And the way that we're looking at this from the public health arena is, if you don't have a roof over your head, it's literally impossible to have good health. So when we are trying to talk with patients who come on our doors, who are coming in, maybe they're hypertensive, they're depressed, they've got diabetes, a number of different issues. They could be asthmatic. A lot of that can be directly attributable to some aspect of housing. Either they don't have housing, the housing conditions that they live in are not quality. Maybe they are transient and are moving from place to place to place frequently. And so we are really trying to, again, focus on these upstream drivers of health, because we can prescribe all the pills that we want, but we're not going to be able to solve for X. We're not going to be able to move upstream unless we help our health professionals understand these social determinants of health. And then again, kind of carve out a space for us. What is the role of public health? We certainly don't want to get in anyone else's sandbox, but we feel like we can be at the table and hopefully be a value add. So Zach, tell us a little bit more about Evictions and the Legal Aid Society and the work that you're doing.
Of course, and thank you, Leslie, very much for having me, and Dwayne and John, thanks so much for really setting up what I was going to talk about. And in fact, Dwayne, you stole one of my statistics that I'm going to give here in just a minute. As Leslie mentioned, my name is Zach Oswald. I'm the lead housing attorney for Legal Aid of Middle Tennessee and the Cumberlands. I've been living in Tennessee and practicing here since 2013. And just as a connection to John, I'm also on the board for Habitat for Humanity in Sumner County here. Legal Aid Society is the largest nonprofit law firm in Tennessee. We have 40 attorneys who are covering 48 counties through Middle Tennessee, and we provide advice and represent clients in legal issues for free. That's the work that we do. We're in court, not charging our clients, and we are doing work that is supposed to be there to provide safety, security, and stability for low-income people, seniors, and domestic violence victims. That work can include anything from helping people obtain or retain housing, to help them secure public benefits, or to help them escape domestic violence situations. As we do work for those who couldn't otherwise afford an attorney, not only are we trying to secure equal access to justice based on poverty levels, but we're also trying to promote racial equity through the Tennessee court systems. As Dwayne mentioned a little bit ago, on the home ownership front, looking at systemic practices that really date back to the GI Bill after World War II, and even further than that, people of color have had less options and harder climbs to be able to secure permanent housing. My statistic from 2014 is that 71% of white families lived in owner-occupied homes. However, only 45% of Latinx families and 41% of Black families were able to have ownership, home ownership at that time. Additionally, research has shown that homes of similar qualities even today that are in majority Black neighborhoods are valued at approximately 23% less than those in neighborhoods with few or no Black residents. That 23% less valuation averages across the country to $48,000 per home in value that Black residents are having stolen from them due to underscored valuations. And as John and Dwayne both mentioned, because the home is the primary asset in America, the fact that there is such a disparity in home ownership necessarily exacerbates the already pre-existent wealth gap in America. Switching from home ownership to rental housing, a statistic from Evicted by Matthew Desmond showed that women from Black neighborhoods made up 9% of Milwaukee, Wisconsin's population, yet it also represented 30% of the tenants who were being evicted. Black people make up 13% of our general population. However, Black people represent 40% of America's homeless population. And as we're talking about being able to secure housing, being able to overcome disparities, the problem is that systemic issues only continue to be exacerbated by housing policies that pose a potential disparate impact to people of color. 1 out of every 19 white people currently have FICO scores below 620, but compare that to 1 in 9 Hispanic people and 1 in 5 Black people. And when we're talking about using credit scores as a barrier to be able to get and obtain rental housing, that 1 in 19 versus 1 in 5 disparity automatically clicks the Black people, the 1 in 5 Black people, into a system where I apologize, my dog is barking in the background, into a system where they have to look to substandard housing because they don't necessarily meet the qualifications that may be arbitrary. Additionally, because the percentage of charges and convictions against people of color versus white people is outstanding, it's again exacerbated in housing because of the disparate impact that happens with criminal background check policies. Finally, issues related to eviction end up haunting renters forever. There is no mechanism in Tennessee to expunge an eviction record in Tennessee. And that's even true as we're going through COVID-19 right now, that even evictions that are going to be COVID-19 related cannot be purged from somebody's eviction record, which means that thousands of households in Tennessee who are being evicted right now due to the struggles from the pandemic will continue to carry the scarlet letter E of eviction with them for the rest of their lives, making it even more difficult for them to find housing outside of the substandard market. All of that with that lens there for everybody, what has the last year looked like to legal aid? Problem number 1 that we've dealt with is misinformation. As the CDC eviction moratoriums came through, they were put into place, then they disappeared in the western part of the state because of a federal court ruling. Then they were renewed, and then the Supreme Court said things about it. That misinformation allowed tenants to get to think that they were allowed to stay without paying rent. They didn't understand that those obligations still stayed there, and lower income, lower educated families were the primary recipients of that misinformation. Problem number 2 that we faced in the last year was pretextual evictions. Landlords who couldn't evict their tenant because of the CDC eviction moratorium based on non-payment of rent suddenly were non-renewing tenants' leases and evicting them because the lease had expired, or finding material breaches of the lease that maybe had been overlooked before. Problem 3 that we faced this year was landlords who found that they couldn't secure evictions through the court system were using extrajudicial means. They were using lockouts. They were shutting off tenants' utilities to try and force them out. There were some positives that we've had from the last year. Is finally we've gotten a focus on eviction and affordable housing like never before. We've gotten a focus as we're speaking here today on a Tennessee Department of Health webinar on housing as it relates to health outcomes. Leslie did a great job of explaining how housing necessarily affects how somebody's health and well-being is moving forward. And a final positive is an influx in funding for rent relief and for supportive services. In Nashville, there's a housing diversionary court now called Legacy Court and the HOPE program, which not only requires landlords and tenants to mediate and settle their differences, particularly for non-payment of rent cases, but tenants are there in court with the HOPE program, with rent relief funds that are available so that the tenant can get their rent paid, so that the landlord can be made whole. And then housing navigators are there on site, not only to help the tenants if they need to find housing somewhere else in the future, but to connect them to social services through the Metro Action Commission. And we're seeing that not only spur up in Nashville, but we're seeing pockets of it across the state, and it's a wonderful development. We're seeing funding that's being provided to legal aid programs to pilot an expanded eviction defense program, including attorneys in the courtroom. This is particularly exciting to me because the statistic prior to COVID-19 was that in eviction court, 90% of landlords had attorneys who were able to represent them during the eviction process, compared to 10% of tenants who had attorneys who were able to represent them in the eviction process. That doesn't mean that the work is done. Where we are now, 1 in every 5 households in America is still currently at risk of eviction as of today. The eviction moratorium is gone, meaning that evictions for any reason can restart. Those are being filed every day. And while rent relief is available, it's not necessarily accessible for everybody who would qualify for it, and there's no requirement for the landlord to participate in the program. For tenants who are left without a landlord who's willing to participate in that program, rent relief can be paid directly to the tenants under the Department of Treasury guidelines and White House responses on these rent relief funds. However, not every program in Tennessee has expanded their program to allow for direct payments to tenants, which means they're not able to access those funds unless their landlord is willing to participate. I'm really excited to participate in this webinar series and to kind of get moving forward with any questions this morning. Leslie, thank you again for having me.
Thanks so much for that, Zach. And I can't thank all 3 of you enough, because you each bring such different perspectives to the table, but you all are operating in an incredibly important aspect of this housing arena. And just to have your expertise and your wisdom, and for you to explain in plain language a lot of these concepts, I know that I personally have learned an enormous amount about housing in this last year and a half or so partnering with you. And for that, I just feel very fortunate, because it's really helped to just provide a lot of information that our teams otherwise wouldn't have. So we're now going to move into the moderated discussion part of this, and then we'll take some of the audience questions, and we'll wrap up then with one final question towards the top of the hour. Let's continue with the theme that we just had. So Dwayne and John, in a minute or two, and Dwayne, I'll start with you. Let's continue with that past year and a half theme. What's happened in the past year and a half, Dwayne, that has been promising, that's maybe changed the conversation, changed the policy, changed the funding landscape? And what has happened in the past year and a half that maybe has been frustrating or something to work through?
Yeah, well, I talked about aging in place, and that's a big program for us now. And so there's been a huge lack of socialization for these families, and I would say that the majority of the families we serve through that program are extremely low income African Americans who are living on probably less than $1,000 a month. And so it's sort of intense now trying to catch up on the projects that were in the pipeline prior to COVID. And so we've just had a lot of them waiting. Some conditions get worse. Some of the clients pass away before we get to them. But like in any emergency, since I've been working for Habitat that has to do with housing, the government generally rallies like they're doing with legal aid, and we get some additional support. And so there are funds that have come down through the CARES Act. Now we're talking about dollars from ARPA. And so there are a lot of new opportunities to access dollars to support and impact these families who've been affected by COVID.
Thanks.
And the other thing is that just the impact for the affordable housing piece, the cost of materials, the delay in material and what have you, the price of construction has increased about 25 to 30%. And so we have to pass that cost on to our homeowners. And so we have had, for the first time in many, many years, increased the minimum income limits for our families. And so that's changed the landscape of who we're going to be able to serve. We're having gaps between the cost of construction and the appraisals, even though appraisals are really out of sight across the state and across the country. And that's good in many instances. For the way we work, it isn't necessarily helpful because we have this gap. The cost of construction is still outpacing these really good appraisals, and so we find this gap. And so it's just a myriad of things.
Thank you for that. John, what about you? What's been good about the last year and a half and challenging? Try it again. There we go.
All right. So a lot of good things and a lot of not so good things. I will start in a similar road to Dwayne. From a Fraser CDC perspective, we've built a lot of new homes, new affordable homes as well, for people who reside in Fraser. And just like similar to Habitat for Humanity, there are income levels as well. And again, the appraisal process, the houses are appraising for higher because year over year, real estate values have gone up maybe 20% overall in the Memphis MSA. In Fraser has actually led real estate values throughout Shelby County from a percentage standpoint. But again, you have to keep in mind, they were so low, people were buying houses for affordable, houses that you can move in for $15,000 a few years ago in Fraser. So again, that gap, that valuation gap was large. So again, we have disseminated a lot of funds for rental assistance through, again, like the CARES Act. We've done a lot of great things with Fraser CDC, also looking to boost commercial activity as well. And that's really important from a economic justice standpoint, because here in Memphis, African Americans make up less than 1% of business gross receipts in the area. So that means that even from a business perspective, the gap is worse than from a housing perspective. We only make up 1% of gross receipts from business. So we are looking to sort of spur on that economic growth from a business perspective. With Fraser CDC, we have a huge grant that is actually targeted towards bringing businesses to Fraser. On the real estate side, from residential, what I've noticed is that the good millennials are leading the way in home ownership. They are now the leading group of new homeowners in the country. And in particular in Memphis, downtown Memphis actually has more residents living in it than downtown Nashville. There's a lot of economic growth geared towards downtown Memphis. I say we are where Nashville was maybe 5 or 6 years ago, but it's going to look different because we're more heavily residential populated versus Nashville as well. A few other good things that I've noticed is that we are trying to create task force to address blight here in Memphis. We have an authority called the Blight Authority of Memphis, where their main goal is to go out and look at these abandoned and dilapidated houses and turn them around in our inner city neighborhoods. Great young lady, Leslie, she's the president over there, or executive director, and she's already got the ball rolling. They're going to be tackling neighborhoods such as South Memphis, North Memphis, Orange Mound, with aggressive plans to alleviate those blighted neighborhoods, of course, which can be health issues also. Then on the flip side, you have new committees formed by the Shelby County government. They have a task force to really help raise the property values in Orange Mound, and I believe the Memphis 3.0 plan is going to help alleviate some of our inner city neighborhoods as well with economic development. That's one of the things that I think holds Memphis back, where you see investments in what we call more wealthier neighborhoods versus your inner city neighborhoods. And we really have to make sure that we provide those resources to not just certain zip codes, but to all zip codes as well.
Great, thank you for that. The next question, Dwayne, I'm going to gear it towards you. In 1 or 2 minutes, it's hard sometimes to describe how housing is funded and how it gets built. The majority is from the private sector, essentially, right? So a developer coming in, building a home, and then there are groups like yours, Habitat, who are nonprofit developers coming in and really helping to provide housing in a housing gap, if you will, and working one-on-one with families. And then I think we often get stuck in sort of this affordable housing nomenclature, where we hear affordable housing, a lot of folks automatically jump to Section 8 housing and think of housing in that kind of space. That's why one of the words that I've been using recently that I heard and I really liked was more of this notion of attainable housing, because the different definition of attainable is different for everyone, right? I mean, income levels vary. But we need to have communities with a variety of housing price points. We need to have a variety of rental housing and homes for sale. And so in a minute or so, what do you feel is the best role for government to play in helping to make sure that there is a variety of price points? Because it's a tricky equation. How does government get involved but not overstep into the market arena so that it's helping to preserve the housing stock, but acting within its rights, if you will?
Well, I think the first thing I'll say is we use that word affordable to really hone in on the fact that so many of the applicants that come to us looking for an opportunity to have a different living situation, which for us is home ownership, they are spending more than 50% of their bring home pay on their shelter. That we see that every day. And so we're trying to get that down to less than 33 to 30%. which is the norm. It's where we typically want to be. So that's I think the significance of the word affordable. As far as the government, I think the government, I think funding is really it. Providing accessible funding that doesn't have, overbearing restrictions and regulations that make it difficult for us to use once we get it. It's one thing to apply and tell the story about what you're going to do with it. Implementation and follow through is something very different. And so one of the things that we really need for the population that we serve is still access to down payments. And so providing down payments for low-income borrowers, more access to housing programs like home dollars and shop funds. If you don't know what those are dollars that come down from the federal government through HUD that are used to supplement affordable housing projects. SHOP in particular is used to assist in infrastructure, especially in rural communities where there's a need to take a vacant lot and put in sewer connections and things like that, or you can buy land and lots with it and develop it. There's been a lot of conversation, I'm not an expert on this, but about the mortgage interest deduction. And most people believe that really favors high income homeowners. And so there's a lot of talk about work needing to be done on that. More investment in those formerly redlined communities that have suffered a lot of disinvestment over the years, which is why we're really happy that we're working with the local TIF here in Memphis. They're using tax increment finance dollars, where we keep a little bit of the tax dollars that would go to the capital to reinvest in these communities. And so that's been very good for us. We can leverage their investment with the money that we can raise from the private sector. And then, of course, I would agree with what others have said, continuing to work on minimizing right now evictions and foreclosures during this pandemic.
Thank you. That's really helpful. And one of the reasons I brought up that question is our session last year, I think that was one of the #1 questions, is sort of who provides housing. And I think for the many who are not in this housing urban planning arena, there's sort of two camps or two categories, if you will, of housing, kind of thinking of that private home ownership or apartment that someone rents, and then again, kind of subsidized housing. And I think often subsidized housing comes up with a bad reputation, if you will, over the years, how we've talked about it. And so that's one of the journeys that I'm on, is how can we talk about all that space in the middle and recognize that it's not just one or the other, and also try to make sure that we're not talking about Section 8 housing and subsidized housing in a disparaging way, if that makes any sense.
Leslie, can I respond to that?
Absolutely, please do.
I think the really important point is that, and I can only speak from my experience with Habitat, is that what we're trying to do, it's not just about the physical house in this moment. It is about home ownership, and it's about changing the trajectory for the families and their children and where they're going in the future. And so if we do it properly, there will be less need for assistance from federal programs in the future. So that's what that's really about, is this is an investment today for a more positive future. And then the other thing is, in many of the communities where we're working, like in Fraser and where we're working in Uptown, no other developers are going to go there really anyway. So if we're taking our dollars to build a new home on a formerly blighted lot, we are having a huge positive impact on the community and on the city overall. And so whatever those investments might be, from government, the private sector, overall, it is a more large scale positive outcome that is occurring.
That was beautifully said. Thank you so much. Zach, I'm going to punt one question to you, then we're going to go to audience questions, and then in the last 3 minutes, we're going to do a little bit of a rapid fire where each of you are going to get a different question. So Zach, you're on a panel today with folks from different sectors. You know, we're in the public sector. You've got Dwayne with a nonprofit, and you've got a realtor who's also part of a community development corporation. You're an attorney with a nonprofit as well. And what do you think about the role of public health? We recently were awarded a grant and tried to think outside the box a little bit, and are happy to announce that we're working with both Habitat for Humanity in Memphis on some housing retrofits and working with Legal Aid Society on some education around evictions. But if you had a wish list for us in public health, what is it? What can we do to best serve this conversation?
Well, that is quite the loaded question, Leslie. But what I would say is taking the steps like we have today, is recognizing first how intrinsically linked health and housing are. Recognizing that the ability to go home, to know where you're going to rest your head at the evening, is going to promote your mental health, which is going to promote your physical health, which is going to allow you to be able to work more often. You're not going to have to take off work because of your maladies and things like that. And so being able to ask the Department of Health basically to promote housing initiatives, to hold sessions like this, to support organizations like Habitat for Humanity in Memphis, to support organizations like Legal Aid, who prior to having this recent influx in resources, we were so busy just trying to keep our head above water, trying to prevent the evictions that were coming to us, that we weren't even in a position to affirmatively go out there and start to enforce tenants' rights who are living in substandard housing, who are living in those places where the conditions are so unkept that we weren't able to enforce those rights for tenants. But now we've brought more attorneys on board. We've brought attorneys into the courtroom to be there for tenants, whether or not they knew legal aid existed before they show up that day, to be able to have somebody there with them and to be able to enforce their rights, particularly when it comes to these substandard issues where people are living in homes that should be condemned, homes that are violating codes, homes that are violating the health code, so that we can start to correct those errors and not only make sure that we're keeping a roof above somebody's head, but that we're keeping a roof above somebody's head that's worth living in and that's going to keep them safe and going to promote their stability moving forward on a health scale.
Thank you. Sorry about that. We're now going to get into some rapid fire questions. So Dwayne, we have a request for the paper that you mentioned, and I think a couple of questions about the statistics in that. So if you don't mind sending that our way, we'll send that out. There is a question about local legislative moratoriums. Is anyone aware of communities that are trying to prohibit as many outside investors coming in and raising rents, and or I know there's been some conversations about Airbnbs as well and taking existing housing stock. Quick 20-second answer. Anybody know communities in Tennessee that are addressing that, either of those issues? Okay. Thank you. I think we could probably do a whole webinar on the need to do that. So we have a question about felonies and the ability to apply for probably a housing subsidy if you have a felony. Is that something that we can anyone address really quickly in 10-15 seconds? Go ahead, John, if you want to answer that. You have to unmute, sorry.
I think that's more of a individual legal issue, and it goes back into what Dwayne says, where we have all these large corporations who are now the gatekeepers of rental properties. So they're really scrutinizing applications that you have to be making. You have to earn 3 times as much, no credit, no felony. So the large corporations that are coming into our communities, are becoming the gatekeepers of affordable housing. Yeah.
Can anyone quickly talk about the impact of regulations for subsidized housing to be smoke-free, and does that disproportionately affect some of the tenants? You're gonna have a quick answer to that. Okay, no quick answers to that. We will follow up. I have some work that's being done in Nashville, so I can follow up with that individual. Well, some of the rest of our questions are really about, I think, policy, and so we're going to end with some of that. So I am going to, Zach, pick on you again. You have 1 minute, and I'm picking on you because you've got that attorney hat, right? We're not going to hold this to you. You don't have to talk on behalf of legal aid, but we've had a couple of things come up where we've heard that you're not automatically eligible, let's say, for legal representation, like you might be under another court system if you're getting evicted. We've heard about some of the other restrictions that you were talking about. Do you have kind of a policy wish list that you would like to see in your career for policy to change?
The number one thing that I would say, Leslie, in terms of how the current state of the law affects tenants is that there are a lot of provisions within the state Landlord Tenant Act that allow the landlord to receive attorney's fees as a result of their representation if they win in court, and there are not reciprocal abilities for tenants to be able to win attorney's fees for their cost in court, which obviously chills the ability for the private bar to even go out and represent tenants. If a tenant is already being evicted for some purpose, if they're a renter instead of a homeowner, they probably have less financial means to be able to afford an attorney. And without that incentive for a private attorney to be able to obtain their fees, to be able to be paid for the work that they're doing, that's where we see this gap of 90% of landlords who have representation in court and only 10% of attorneys. I would love to see something that allowed tenants to recover their attorney's fees if they were victorious in court. It put me out of a job, and I would gladly go find more work to do.
Okay, great, thank you. So, John, blank check. If you had a blank check, somebody gave it to you today, how would you invest that funding?
I would invest that funding through pallets, tips in North Memphis, South Memphis, Orange Mound, Binghamton. I would give subsidized funding to developers to, can you hear me?
Mm-hmm.
Yeah, I would give subsidized funding to developers to go in those inner city communities and put the resources that they place other places. I would have government allow for mixed use communities in those various communities where you mix business and residential buildings. I would also give more education to homeowners. There are programs out there that, like NACA.com, actually where it allows you to buy a house that's not necessarily credit based, but they feel like if you can rent a house, you can buy a house. And NACA was born through legislation for discriminatory practices by some of your larger banks. So those are my blank check wish lists.
All right, Dwayne, last word is yours. Career nirvana, what's the biggest change that you would like to see by the time that you wrap up your career?
Oh, wow. Now that's very loaded. Oh, gosh. It's sort of twofold, the elimination of substandard housing. And I just say around the world. I know that's a huge jump from our local community, but substandard housing is a worldwide issue. And if I'm speaking for myself or Habitat in any way, I have to speak from that perspective. Internationally, we just want to wipe substandard housing from the face of the planet, and then make sure that everyone has a decent, safe, affordable place to live.
Well, thank you to all three of our panelists today. We can't thank you enough for bringing your expertise to the table. This was fabulous. We've already gotten a lot of kudos for all of your remarks. You are valued partners of the Tennessee Department of Health. We thank you so much for your time, and we look forward to continuing to work together. Everyone, have a wonderful afternoon.
Thank you, Ron.
All right, bye-bye.